This paper reports a trial we have performed, which is a first-use pilot study on a new apparel that uses compression and also Vari-pad technology, and it reports the patient-reported improvement and also the objective measurements we used. There are no relevant disclosures at the time of the trial. Previous research has shown that cellulite affects somewhere between 80 to 90% of post-pubertal adult females, and is a cause of concern in 98% of all adult females, and it's known to lower self-esteem. This is a photograph over here of the garment with the Vari-pad technology in place, and this is the inside, so it's been turned inside out for you to see this. These pads here are in contact with the buttocks, here the underside of the buttocks, and here the thighs. Over here we can see the Vari-pads of different sizes themselves. The different heights give the lymphatic massage that help milk away the fluid causing the cellulite. In this study, there were 18 females, the mean age 47.5, with range from 26 years old to 60. There were 2 weeks stabilization, 4 weeks of treatment, in which time the participants wore the garments for 8 hours out of each 24, and 2 weeks of observation. Therefore, there were 9 visits as noted on the slide. On each of those 9 visits, the patients were asked about their satisfaction with their cellulite using a visual analog score where 0 was the worst and 10 was the best. Their weight was measured to make sure they were not putting on any weight or taking off weight. 3D images were taken, which were analysed afterwards by Canfield. Transcutaneous water content was measured using the lymph scanner from Delphin Technologies, and comfort of the product was then assessed using again a visual analog score from 0 to 10. The results showed that the patient's satisfaction after wearing the product increased significantly by 18.5%. There was no significant change in weight throughout the study, showing that this was not a cause for any change in their satisfaction or any other findings. 3D imaging showed no difference at the buttocks, but there was a significant reduction in the dimpling found in the thighs. And this was mirrored by the transcutaneous water content, which again showed no significant change in the transcutaneous water in the buttock tissue, but a significant reduction in water content in the thighs. Patients found the product with the Vari-pads to be comfortable, 8.6 out of 10, and there were no adverse reactions or rashes. In discussion of these results, we know that the 3D volume loss was underestimated because we often had imprints from other clothes on the skin. The improvements in both the imaging and the water content found in the thighs but not the buttocks is probably due to the thickness of the fat layer between the skin and the muscle in the two areas, with the thigh having the muscle closer to the skin and therefore a firmer base for the compression to act against in the short term, and we think that longer term studies we might be able to see more of an improvement in the buttocks. Although subjective patient satisfaction may be a placebo effect, we certainly found this in 11 out of 15 of the patients, which is more than we'd expect for a placebo effect after only 1 week. Also, of course, it's most important what patients think, because after all, that's what we're trying to improve. Patient comments were not included as part of the protocol, but most patients did note a comfort of the product to be very good and also a smoothness of the skin. The limitations, of course, is that this was only a short trial with 4 weeks of 8 hours per day of wearing the product and also small numbers, not allowing us any subgroup analysis, such as cellulite grade or HRT usage. In conclusion, we found that after 4 weeks of wearing the compression garments with the Vari-pads, there was a significant improvement in the satisfaction of the participants when assessing their own cellulite. Although there was no change of cellulite on the buttocks that we could find objectively we found an improvement on the thighs using 3D image analysis and also reduced transcutaneous water content. The participants reported the garment to be comfortable with no adverse reaction, and all of this leads us to the conclusion that larger studies are warranted to try and find out exactly the improvement of cellulite caused by the Vari-pads and compression garments.